The reason that I wanted to become a doctor was to really help people. I felt this was the most straightforward way of really making a difference in someone's life. I do have some role models in my family who are physicians. My uncle is an orthopedic surgeon. My aunt is an anesthesiologist, and so I do have some role models that I followed in their footsteps, so to speak. It was the field of medicine as a whole that drew me to it. I can't say there was any one factor. It was just a desire to really help people in a way that left a lasting impression for the patients, and then helped me attain a measure of satisfaction with what I did every day. My training was in Jefferson Medical College in Philadelphia, Pennsylvania. My ophthalmology residency was done at Wills Eye Hospital, also in Philadelphia. And then I went on and chose to do cornea and refractive surgery. That training was done at Wilmer Eye Institute at the Johns Hopkins Hospital. So the field of ophthalmology is rapidly changing and growing. There are lots of new innovations, especially in the area of cornea and refractive surgery. It can be challenging to keep up with those advancements, and I find the best two main ways of doing it are going to be reading the peer-reviewed journals to know what's the most recent up there, and then attending the national meetings. There are two, one in the spring and one in the fall, that I try to attend if I can, where I can keep up with all the latest developments and changes and advancements. I really enjoy doing refractive surgery. I love doing LASIK. It very much marries up with my desire to make a very direct impact on a patient's life. I love being able to take someone from glasses and really tied to glasses, almost handcuffed in a sense, with glasses, and within a matter of half an hour, have their vision improve to a point where they can walk out of that office and actually see, and within a day or 2 days really have very, very good functional vision. I have been doing refractive surgery for about 10 years now. I started with my training at Johns Hopkins, and then I spent about a decade in the military doing a lot of refractive surgery with them, and I have loved every minute of it. It is a very gratifying procedure to be able to provide. I was in the Air Force, captain. When I left, I was a lieutenant colonel. I sort of fell into it. I was looking for a way to help fund my medical education that didn't include loans, and one of the recruiters came on to my college and did a presentation, and it happened to be the Air Force, and it sounded like a very good idea, and they would fund my education for that amount of time that I would be active duty, and that sounded like a great trade, but it turned out to really work in both parties' favor, because once I moved here, I really loved the Air Force so much that I stayed twice the amount of time that my contract had said. So I really had enjoyed my time with them. So when I was active duty, I had a patient referred to me that had LASIK on the civilian side many, many years ago, before he ever joined the military. And he had struggled with epithelial ingrowth underneath the LASIK flap. And he had been watched and watched for a while, with no intervention, with the hope of kind of maintaining him there. But that ingrowth really took a turn for the worse after he got poked in the eye and the flap was disrupted. And so the ingrowth really sort of took off and was really affecting his vision. He was at risk for a flap melt. So he was referred over to me. When I took a look, it was pretty impressive. It was probably the most impressive ingrowth I have seen. And treatment was going to be challenging. So I had a very long discussion with him, warned him of the risks of recurrence, which was very, very high, as these cases often recur. And we underwent the treatment, which was really to lift the flap, scrape off all of the ingrowth. And then I used a new technique I had been reading about and had heard about at the meeting, our national meeting, of using tissue glue to seal the edge of the flap, with the goal being to prevent new cells from growing underneath the flap. And then a contact lens over top of that to help. And I explained all this to him. He was agreeable to moving forward. We tried that. And at first we were quite successful. I was very encouraged. No epithelial ingrowth for about 4 to 6 weeks. But at the end of that time period, we started seeing new cells growing in again. So it was definitely a challenge, and he was prepared. He knew that it was very likely to happen, but definitely disappointed. His vision took a little bit of a nosedive. So he came back, This time I said, okay, we've tried the glue, we've tried the contact lens, it didn't seem to help. We're gonna go back to what I was taught in my fellowship, to really close the flap where the area of ingrowth is with sutures. So we took him back under the microscope. I repeated the same thing, peeled off all the old cells underneath the flap, put the flap back down, and then actually sutured the flap, which was challenging. The flaps are not very thick, and to stitch those closed with very nice radial sutures are very challenging. But I enjoyed it. It was a good challenge. I put in about 5 stitches, and it took about 2 months before I released anything. And he's now a couple of years out from that, and he has had no recurrence. Very happy. Vision is 2025, and with correction is 2015. So he's very, very happy. It was an interesting case for me. So the very first thing, almost on the first day that you walk into medical school, is one of the first things they really stress is first do no harm. So I approach every patient with, yes, I want to help, but my first tenet is do no harm. I don't want to make the condition worse. And especially when it comes to things like refractive surgery, that's a that's a line that I'm very cognizant of, because if refractive surgery is not undertaken carefully with a lot of thought and planning, things can go south, not necessarily during the procedure, but in the years that follow. And so that thought, first do no harm, is always forefront in my mind. And then of course the desire to, what can I do to help this patient, whether it's refractive or whatever other problem may walk in, what can I do to help that patient while not making the existing problem worse? I think I'm a transplant from the Northeast, and I came for the military and then chose to stay. San Antonio really grows on you. Both my husband and I love it here. My kids were born and brought up, so to speak. They're only 8 and 6, but this is what they know. And so we love the city. I've spent almost 10 years here now, and I've become very comfortable in my area of expertise, my field. And I really love what I do. I love the patients that we see every day. I love being able to help them in whatever way I can. And I really enjoy the choice that I made, not just in medicine, but to go into ophthalmology. It really is a very fulfilling field.